Kids are back to school, the fall leaves are all on the ground, and the days are now shorter with less sunlight hours. There's a lot on your plate, but you can't seem to just get going and get motivated to do anything. Do you also feel stressed? Do you feel overwhelmed or down? And notice that this seems to be occurring at the same time every year. If your answer or someone that you know's answer is yes, then you'll want to stay with us today as we discuss seasonal affective disorder, or more commonly known as S.A.D. Welcome to Revivelife. I'm naturopathic Dr. Joël. Weather often affects people's moods. Sunlight breaking through the clouds can lift our spirits, while a dull, rainy day may make us feel a little gloomy. While noticeable, these shifts in mood generally don't affect our ability to cope with daily life. Some people, however, are vulnerable to a type of depression that follows a seasonal pattern. For them, the shortening days of late autumn are the beginning of a type of clinical depression that can last until spring. This condition is called seasonal affective disorder, or S.A.D. A mild form of S.A.D, often referred to as the winter blues, causes discomfort but is not incapacitating. However, the term winter blues can be misleading. Some people have a rarer form of S.A.D, which is summer depression. This condition usually begins in late spring or early summer, and awareness of this mental condition has existed for more than 150 years, but it was only recognized as a disorder in the early 1980s. Many people with S.A.D may not be aware that it exists or that help is available. S.A.D can be a debilitating condition, preventing sufferers from functioning normally, and it may affect their personal and professional lives and seriously limit their potential. It is important to learn about the symptoms and to know that there is a treatment to help people with S.A.D live a productive life year-round. The disorder may begin during the teen years or in early adulthood. Like other forms of depression, it occurs more often in women than in men. And people who live in places with long winter nights, like of course Ottawa, are at greater risk for S.A.D. Going to our Revivelife quiz, we want to ask you, number one, how many of us in Ontario does research suggest get S.A.D? Is it 2 to 3%, 50%, or 75%? Number two, increased cravings for carbs may be a sign of S.A.D. And number three, the only way to treat S.A.D is to take a sunny vacation. In my practice, what I tend to see is that when we do a review of symptoms and the frequency of a person's visits, it clearly suggests a pattern. For example, our records show at about this time of the year, Mrs. Smith typically has appointments booked with an urgent note every October and November. On this note, it may be for seemingly unrelated concerns like PMS or headaches, but they tend to occur at the same time each year, which may have a S.A.D undertone. Low blood sugar or dehydration may also aggravate S.A.D, so ensure that you're eating or drinking fluids every 3 hours. Our snacks this week to add to our 101 snack ideas list are guacamole, and the avocado. The monosaturated fats from avocados help to tell the body, help to release a hormone called leptin, which actually signals our body to tell us that we're full. And what's avocado or guacamole without salsa? So that's our snack number 2 this week. And we, of course, love it with tortilla chips. Try and choose the baked versions for a healthier choice, and you might want to always use a bowl so that you know how much you're actually eating. Somebody once asked me, or actually told me, that they were always feeling sunny when they were around me. And I took that as a compliment, but I also shared that I'm inspired by color and do so with actual intent. Because I work with many patients who may be feeling low, I purposely choose colors that evoke feelings of healing, warmth, and happy emotions. How can you do the same to lift your mood? Well, try using a blue plate when you get the munchies. Blue helps to make you feel more peaceful and can help us eat less when we crave those carbs and sugars. Blue is a very soothing color, and it's also the color of the sky and the sea. Of course, we can also use soothing touches in our hectic lives. Research found that people who were faced with difficult tasks felt less anxious after they saw something blue. And because, of course, it's relaxing, you can feel free to use it liberally than happy or energizing colors. If you want a blue boost, switch to a stronger shade of blue. And yellow or green can help you feel more optimistic or upbeat if we have S.A.D. If you want to bring some flowers into the house, again, these are simple ways that you can boost your mood. Thinking about red or violet, these are stimulating colors which help to boost your energy by causing your body to pump out more adrenaline, especially when the fellas see a lady in red. Surround yourself in this color if your energy is low or you want to get a good workout. Stay with us to find out more about how to lift your winter blues and if you do have S.A.D with naturopathic Dr. Andrea Prue. For some of us, driving in the dark and going home in the dark is the norm at this time of the year. But what if we don't feel like getting out of bed or being social at all? It could be seasonal affective disorder, which is more than just the winter blues. How many of us get S.A.D? Well, research suggests only 2 to 3% of people living in Ontario. However, there are many people out there who feel this way that are just not saying anything. We polled people around town this week and found that at least 50% of them felt that there was a mood change with the seasons, especially the winter, and were definitely looking for sunnier destinations for a break. Because vitamin D is associated with sunlight and mood, be sure to be tested. I have a few patients where we can tell if they are low simply due to the increased need to sleep and low mood. If you're not packing your bags, stay with us to find out what else you can do. Joining us now is our first guest who uses a holistic approach to treat the root cause of a patient's health concern. She regularly sees patients who suffer from seasonal affective disorder as well as other types of mood disorders, including depression and anxiety. Using evidence-based medicine and diagnostics, Dr. Prue works with her patients to better understand the many facets of their overall health, and she was recently voted the #1 naturopathic doctor in Barrhaven and Nepean by the Reader's Choice Award. Welcome, Dr. Prue. How are you doing today?
Very well, thank you.
You certainly don't have seasonal affective disorder.
No, I think we both chose
nice
to wear
smile.
wearing bright colors, as you said.
Yeah, I thought it was interesting. I was just sharing with people, you know, I was sitting getting my hair done for the show. And I was looking outside and I was looking to see how many people look sad. And it's definitely more than 2 to 3%. What do you think?
I would agree in terms of what I'm seeing in my clinic.
Yes.
There's a wide variety of depression and kind of components, and definitely with S.A.D, this is the time of year where it's starting to come in. Although we've been lucky, this November's been fairly sunny.
It's been beautiful out.
But that said, we're still starting to see it come into the clinic in terms of, just people feeling, as you said, just tired.
Exactly.
That's usually the main concerns. I'm feeling tired and just low mood.
Yeah. And it's interesting because when you do chart and you look at, we do a review of systems, and when you go back, you think, well, you know what? We were here last year at the exact same time and you were tired.
Yeah, exactly.
So, okay, so what is the difference between S.A.D and the winter blues? Are they the same thing?
That's a great question, and one my mom recently asked me as well. How am I feeling?
Yeah.
And S.A.D is, of course, has a specific diagnostic criteria where it has to be a certain set of symptoms around depression that recurs every year, typically in the winter months, but also spontaneously resolves again in the springtime, which is where April, May sort of comes about. We all of a sudden just feel better. Yeah. So S.A.D has a very specific diagnostic criteria that, of course, naturopathic doctor or, of course, a family doctor will help a patient better understand. And the winter blues, that low mood, is kind of, a lesser degree of that type of depression.
So as a naturopathic doctor, then, what are the clues that we are looking for in our patients? And again, for you sitting at home, would indicate that you might have S.A.D. What are the symptoms?
Some of the things you alluded to in your introduction around low motivation, fatigue, people just sleeping a lot, which we love to just kind of shrug off as being, well, it's darker, longer, of course I'm going to be sleepier, but that's not necessarily the case, because when we go on vacation to those sunny destinations, we've got lots of energy all of a sudden again.
Yeah, exactly.
So we're seeing that sunlight obviously kind of playing a role. So in terms of symptoms that people are expressing is a lot of this, I'm sleeping more, I'm feeling just generally more tired despite sleeping more. And often there's that carbohydrate craving. I'm kind of snacking on things, maybe to try to stay awake a little longer, get a bit more energy, but it's just this dragging sort of feeling. Everything's just harder to do because mentally that engagement and motivation isn't there.
One of the other things that I like to cue people on is the detachment from social activity. So, people think they're okay, they go to work, they come home, and there's a commitment, or, do you want to go out, do you want to do this? And there's more no's. That's one of the other clues that I find is a good way, no's to social engagements. So with the symptoms, then what we want to understand is what are the causes? Why does SAD happen?
SAD happens for a variety of different reasons. Of course, we in the north, in Ontario and in Ottawa, with less sunlight, that's one of the big reasons. And we're seeing so less vitamin D is being produced because our skin isn't having access to good quality sunlight. Yeah. As I say to my patients, you could be naked in the middle of your backyard in February and it still won't be enough sunlight, unfortunately.
Right.
Not that I recommend being in your backyard naked in February, but
exactly.
that idea is looking at a vitamin D deficiency is typically what it is, and there's hormones that are associated with that vitamin D deficiency, as well as changes in circadian rhythms because it's darker longer throughout the day.
Sure. So when you mention circadian rhythm, some people don't understand that relates to hormones. What are the key hormones that are involved in this whole process of feeling low?
Absolutely. Melatonin is a very big one, even though people tend to think of it simply as related to sleep. But that's when we're getting some of that fatigue component and that lack of awake in the morning is our melatonin issues. So that's one of the big ones that we need to look at in terms of sleep and awake cycles because vitamin D is playing a role there. But also looking at serotonin, so the happy hormone, also plays a role, and estrogen too. And that's why we see SAD and other types of depression higher in females because of how estrogen plays a role with serotonin and melatonin metabolisms.
Yeah, and let's bring the stress component into this, because if we actually look at a graph of cortisol, what tends to happen is cortisol will rise about a half an hour after we wake, and then it will tend to dip a little bit after lunch and then fall off. And as cortisol falls off, then melatonin can rise, which helps to promote a high quality of sleep. Growth hormone follows that as well. Now, if a person is highly stressed, how does that component fit into SAD?
Well, I wish I could say none of my patients are highly stressed.
We all carry a little bit of stress, right?
Which a certain amount is good, of course, because you want to have that drive. But unfortunately, the more we kind of push, and sometimes burn the candle at both ends trying to accomplish so many things, that we're increasing our cortisol levels, so increasing that stress response, making it more difficult to relax at night and fall asleep at night. And as you said, if those cortisol levels are staying high, we're not enabling kind of melatonin to come up. So then we're seeing troubles with falling asleep, staying asleep, poor sleep quality.
Exactly.
So then we wake up tired and the whole process starts again. So
if a person is sitting at home thinking, I have that, what kind of labs does a practitioner need to run for them, and what should they be asking for?
Well, a practitioner, in terms of a naturopathic doctor or family doctor, can run vitamin D levels, and it is best to have them run in August, because that's typically our highest levels here in Canada. But unfortunately, as of December 1st, 2010, the criteria for which, or the eligibility to run a vitamin D test has decreased, which means that it's a little bit harder for a lot of people to access that test through their medical doctor. That said, medical doctors and naturopathic doctors can still definitely run the test, just sometimes it's a cost to the patient. But it gives us a better understanding as practitioners to know how are your levels, preferably in August, to know that how can we dose vitamin D appropriately and safely for that patient.
That's right, important point. So the other labs that I would complement that with would be then the iron, and then looking at potentially cortisol, where is that, and then thyroid, all of these things. But we always have to remember that labs are numbers on a piece of paper, and when somebody comes in, you can really tell by the look on their face, really how tired they are, if they're crying. And again, with seasonal affective disorder, it's increased sleep versus decreased sleep, and it's also increased weight. So all those key factors, you want to put those together with the labs to come to a conclusion. So thank you, Dr. Prue, where you're going to be joining us again in The View. We're going to talk about treatments, and we're going to give you some good tips there. That was great.